Welcome to this essential guide on understanding and managing chronic pelvic pain in women. As a woman or a healthcare professional, it's crucial to be informed about chronic pelvic pain in women. Today, we will explore the definition, etiology, clinical features, differential diagnosis, investigations, and management of chronic pelvic pain in women. The American College of Obstetricians and Gynecologists, ACOG, defines chronic pelvic pain as continuous or non-cyclical pelvic pain of longer than 6 months duration that localizes to the anatomic pelvis, abdominal wall at or below the umbilicus, lumbosacral back, or the buttocks, and is of sufficient severity to cause functional disability or lead to medical care. A significant number of these patients may have various associated problems, including bladder or bowel dysfunction, sexual dysfunction, and other systemic or constitutional symptoms. Other associated problems such as depression, anxiety, and drug addiction may also coexist. Various reproductive, GI, urologic, and neuromuscular disorders may cause or contribute to chronic pelvic pain. 1. Extrauterine reproductive disorders include the following: endometriosis, adhesions, adnexal cysts, chronic ectopic pregnancy, chlamydial endometritis or salpingitis, endosalpingiosis, ovarian retention syndrome, residual ovary syndrome, ovarian remnant syndrome, ovarian dystrophy or ovulatory pain, pelvic congestion syndrome, postoperative peritoneal cysts, residual accessory ovary, subacute salpingo-oophouritis, tuberculous salpingitis. 2. Uterine reproductive disorders include the following: adenomyosis, chronic endometritis, atypical dysmenorrhea or ovulatory pain, cervical stenosis, endometrial or cervical polyps, leiomyomata, symptomatic pelvic relaxation, genital prolapse, intrauterine contraceptive device. 3. Urologic disorders include the following: bladder neoplasm, chronic urinary tract infection, interstitial cystitis, radiation cystitis, recurrent urethritis, urolithiasis, uninhibited bladder contractions, detrusor sphincter dyssynergia, urethral diverticulum, chronic urethral syndrome, urethral caruncle. 4. Musculoskeletal disorders include the following: abdominal wall myofascial pain, trigger points, compression fracture of lumbar vertebrae, faulty or poor posture, fibromyalgia, mechanical low back pain, chronic coccygeal pain, muscular strains and sprains, pelvic floor myalgia, levator any spasm, piriformis syndrome, rectus tendon strain, hernias, obturator, sciatic, inguinal, femoral, spigilian, perineal, umbilical. 5. Gastrointestinal disorders include the following: carcinoma of the colon, chronic intermittent bowel obstruction, colitis, chronic constipation, diverticular disease, inflammatory bowel disease, irritable bowel syndrome. 6. Neurologic disorders include the following: neuralgia, cutaneous nerve entrapment, surgical scar in the lower part of the abdomen, usually iliohypogastric, ilioinguinal, genitofemoral, and lateral femoral cutaneous nerves, shingles, herpes zoster infection, degenerative joint disease, disc herniation, spondylosis, abdominal epilepsy, abdominal migraine, neoplasia of spinal cord or sacral nerve. 7. Psychologic and other disorders include the following: personality disorders, depression, sleep disorders, sexual and/or physical abuse. Like other types of chronic pain, chronic pelvic pain may lead to prolonged suffering, marital or family problems, loss of employment, disability, and various adverse medical reactions from lifelong therapy. Patient history is important in cases of chronic pelvic pain because of the complex etiology and often the presence of associated disorders. The location of pain is an important part of the history. Obstetric, gynecologic, and other system examinations could be long and stressful. Detailed examination of obstetric, gynecologic, and other systems can be performed in different positions. Usually this includes standing, sitting, supine, and lithotomy positions. Differential diagnoses include adnexal tumors, anorectal abscess, benign lesions of the ovaries, benign vulvar lesions, cervicitis, chronic pyelonephritis, colon cancer, colonic obstruction, constipation, cystitis, nonbacterial depression, diverticulitis, dysmenorrhea, endometrial carcinoma, endometriosis, endometritis, familial Mediterranean fever, gonorrhea, gynecologic pain, irritable bowel syndrome IBS, lumbar spondylosis, osteophytes, bone spurs, malignant neoplasms of the small intestine, neurogenic bladder, ovarian cancer, pelvic inflammatory disease, rectal cancer, ulcerative colitis, urethral pain syndrome, uterine cancer, uterine prolapse, vaginitis, vesicovaginal and ureterovaginal fistula, vulvovaginitis. Laboratory studies include CBC count and sedimentation rate, serum drug screen, urine test, urine culture, urine cytology, cystourethropy, and intravenous pyelography or CT scan. Sexually transmitted disease testing, hormone assays, follicle-stimulating hormone level, estradiol level, and gonadotropin-releasing hormone agonist stimulation testing can be helpful in cases of ovarian remnant syndrome. Thyroid-stimulating hormone testing is used for evaluation of hypothyroidism, especially in a patient with depression. Perform stool GAIAC testing in patients with gastrointestinal symptoms and in patients older than 50 years. Testing stool specimens for ova and parasites also may be helpful in selected case. Imaging studies include MRI, CT scanning, ultrasonography, plain film radiography, hysterosalpingography, vaginal sonography, voiding cystorthrography, double balloon cystorthrography. Medical care includes pharmacotherapy, physical therapy, psychophysiological therapy. Surgical care. Various minimally invasive techniques may provide pain relief. These techniques include the following. Trigger point injections. These injections are used mostly for localized trigger points, myofascial pain, or neuroma. Peripheral nerve blocks. Specific peripheral nerve block with local anesthetic and steroids may be helpful in selected cases. Neuroablation of selected nerves can be performed by using different techniques. Thank you for joining us in this educational journey on understanding chronic pelvic pain in women. Stay informed and take proactive steps to safeguard your health.